Are your patients with shoulder pain not improving as you expect? You know that subacromial syndrome is one of the most common shoulder conditions and one of the leading causes of pain. And even though the clinical diagnosis may seem straightforward, many times the exact cause of the pain remains hidden. Often, the pain persists despite treatment, and you wonder, am I missing something important? The answer could lie in imbalances in the scapulohumeral muscular synergies, which disrupt the synergy between the anterior deltoid, the upper trapezius, and the lower trapezius. Without analyzing them, you run the risk of applying treatments and exercises that don't correct the problem or even make it worse. This is where surface electromyography comes in, a tool that lets you clearly see how the muscles behave during the patient's actual movement. You won't have to guess anymore. You'll be able to measure, compare, and act with precision. Imagine being able to identify whether your patient is flexing their arm with excessive activation of the deltoid or if the lower trapezius is barely involved. Now you can do it with objective data that will transform your clinical reasoning. Do you want to learn how to identify these patterns in your patients and use data to decide which muscles to work on? You can schedule a free call using the link we've left in the description. Just 10 minutes, no obligation, completely personalized. With this practical guide based on surface EMG, you'll be able to identify key muscle imbalances in these patients and design truly effective treatments. Step 1. Identify the symptoms that give you clues. Before placing the electrodes, you're going to do an assessment and listen to your patient. What patients most often tell you is, it hurts when I lift my arm above my head. I feel like I have less strength in my shoulder. It's hard for me to get dressed or reach objects that are up high. What should you suspect? These symptoms are typical of subacromial syndrome, but they also point to an imbalance in the synergy between mobilizer muscles, such as the deltoid, and scapular stabilizers, like the lower trapezius or upper trapezius. Step 2. Assess shoulder flexion with EMG and observe the motor pattern. One of the most useful tests is to ask the patient to perform active shoulder flexion up to 180 degrees, or as far as they can without pain, while recording muscle activity with surface electromyography. You will place the electrodes on the anterior deltoid, the main mobilizer for the movement, the upper trapezius, the levator scapulae, and the lower trapezius, which are scapular stabilizers and rotators. The goal is to see how these three muscles interact during the painful movement. Step 3. You will learn about the typical patterns of neuromuscular dysfunction. What can go wrong? You might encounter an overactive anterior deltoid. If it activates too early or too strongly, it can push the head of the humerus upward and narrow the subacromial space, which leads to pain when raising the arm. You might also encounter a dominant upper trapezius. This causes premature or excessive scapular elevation, disrupting scapular rotation and creating cervical or subacromial tension. You might encounter an inhibited lower trapezius. When it fails to properly rotate or stabilize the scapula ends up in a poor position for movement and the subacromial space is reduced even further. These imbalances are muscular compensations, not the patient's mistake. And if you don't detect them, corrective exercises might not work. The final step is to analyze the results with real clinical examples. I'll give you two. Example 1. Hyperactivity in the anterior deltoid and upper trapezius. Take a look at the result. You have hyperactivity of the left upper trapezius, which increases tension in the neck and scapula. You have hyperactivity in the left anterior deltoid, which increases subacromial pressure during arm elevation. Let's move on to the second example, inhibition of the lower trapezius. Again, take a look at the graph. Here we find a deficit in the left lower trapezius, which leads to insufficient scapular rotation. Therefore, surface electromyography not only allows you to confirm your clinical hypothesis, it also reveals what can't be seen with the naked eye, how the muscles share the workload and which ones are compensating. When you assess subacromial syndrome from a functional and objective perspective, you can correct imbalances at their source, personalize exercises, and avoid overload or compensation. You will speed up recovery and reduce pain. See you in the next post.